Hello and welcome back to another exciting lecture on the digestive system. Today we're going to be doing part 2 of the digestive system, additional suffixes and digestive system terminology, which is chapter 6 in the Language of Medicine 10th edition by David Ellen Schaubner. So let's go ahead and continue the discussion on the digestive system. So here are the goals that we hope to accomplish for the chapter 6, for our chapter 6. To define new suffixes and use them with the digestive system combining forms. List and explain the laboratory tests, clinical procedures, and abbreviations common to the digestive system, and apply your knowledge to the understanding medical terms in their proper context, such as medical reports and records. Let's go ahead and get started. All right, some additional terms, suffixes here that we would want to know. For example, ectasis, and ectasia means dilation or widening. Emesis here means vomiting. Now, don't forget that I'm only going to highlight some of the ones that I would recommend that you would want to study. However, you should study every single one of these terms so that you will have the most preparation for any of the midterms or final exams or any tests that you take, and as well as excellent preparation for the field. There's also here pepsia, which means digestion. So there's a word here, dyspepsia. Dyspepsia here means difficult digestion. We also have here phagia. Okay, phagia, be careful with the pronunciation. I like to pronounce it as phagia to stay neutral here. But phagia here means eating or swallowing. For example, polyphagia. Polyphagia here means excessive eating. Dysphagia. Dysphagia here means difficulty swallowing. We also have here the word plasty. Plasty here means surgical repair, as you probably are familiar with from a previous chapter. Phthisis here means spitting. Rage or rage here means bursting forth, for example, in this example, of blood. We also have raphe, which means suture. Raphe here means suture. We also have rhea, which you probably already familiar with, means flow or discharge. We also have stasis, which means stopping or controlling. And we also have stenosis. Stenosis here means narrowing or tightening. Spasms mean involuntary contraction of muscles as well. So you might hear spasm as part of a medical term, or you might hear it independently. Okay, so it just depends. Trachea here means opening. For example, an esophageal atrasia. Esophageal atrasia, two words, which means the esophagus that is not open to the stomach at birth. Now here are some suffixes that can also be used as independent words. For example, in emesis or in emetic. We also have here spasm, which I mentioned earlier, stasis and stenosis. All of these four different words here, all these four different suffixes can be used as independent terms. Another one here that is not listed, but you should write this down in your notes, is lysis. Okay, lysis here means the disease caused lysis of liver cells. Right. Some additional combining forms that you might want to know. For example, we talked about a lot of these in the previous chapter, but cholangio, which means bile duct vessel. We also have here colodoco, which means, of course, common bile duct. Esophago or esophago here means esophagus. For example, esophageal atrasia, which we just mentioned earlier. We also have here glosso, which means tongue. We definitely remember this word. Gluco means sugar, and glyco also means sugar as well. A lot of these terms we've already seen. Litho here means stone. Pancreato definitely means pancreas. We're very familiar with these terms. We should be, having come from chapter 5. Now, here we go. Procto means anus and rectum. So think about a proctor. And I'm just kidding. But anyway, procto means anus or rectum. Pyloro here means pyloric sphincter. Recto definitely means a rectum. Salideno means salivary gland. A lot of these we've already encountered in previous in the last chapter. Right, some laboratory tests. Sometimes a healthcare professional, or a lot of times, a healthcare professional needs to be able to assess the condition of whatever organ system they're trying to look at. In this case, we're trying to assess the digestive system. There are many different kinds of lab tests that the professional can use to assess a condition. For example, you have here the liver function tests, or the LFT, which are the tests for enzymes and bilirubin in the blood. You also have here the stool culture, which tests for microbes in the stool. And you also have the stool guaiac test, or the Hemocolt test, which is a test to detect blood in the feces. And one of the ways in which the stool guaiac test or the Hemocolt test is used is that the physician would take a sample of do a swipe within the rectum, and then use a particular kind of pad filter. It's a type of filter paper that changes color, a biochemical test that changes color depending whether or not there's blood in the feces or minute blood. Different clinical procedures that can definitely be used to assess your x-rays, definitely using light in the form of x-rays in order to determine the condition of the digestive tract, one of which here is known as one type is a lower gastrointestinal series, using a particular kind of compound known as a barium enema. And lower gastrointestinal series here is an x-ray images of the colon and rectum obtained after injection of barium into the rectum. Now, barium here is a type of contrast medium. Here's the thing with x-rays, and we'll talk more about this in chapter 20. With x-rays, you're shining light through, and this particular kind of light here, say that there's a person, that's a very bad drawing, and then we have here a board, and you have here x-rays, and they're kind of going through the person. Now when they end up landing here onto the board, what typically you'll see are the bone structures, any sort of dense or hard bone in the X-ray image. But the problem here is that the gastrointestinal tract is very mushy and soft. So when X-rays pass through the stomach or passes through the large intestine, etc., etc., you're not going to see anything on the x-ray because it's so mushy. The x-rays go straight past through it and doesn't bounce off of the hard, dense tissue like they do with bone, giving you that nice picture. So therefore, in order to get that bounce, in order to get that image, barium has to be injected into the digestive tract in order to give it that density, so that the x-rays that hit it will bounce off, producing an image on the x-ray page. We also have here cholangiography. Once again, I expect everyone to read all of these particular clinical tests in the textbook, but I'll highlight a couple ones here. Cholangiography here is an X-ray examination of the biliary system performed after injection of contrast media into the bile ducts. Once again, notice a theme here. In order to get an image, especially an X-ray image of any sort of soft tissue, you've got to put in a particular contrast medium in there so the X-rays have something to bounce off of, to give you that nice white color in the back on the X-ray picture. Without it, the x-rays pass straight through, and then the resulting image on the page will be black versus white. Different kinds of clinical procedures that can also be used. For example, rather than using light, one can use an ultrasound. Ultrasound is very similar. What's very interesting is that both sound and light are in the form of a wave. Okay, both sound and light come in the form of a wave, and every type of wave has a particular kind of wavelength, as you can see here, and that determines either A, the type of sound or the frequency, right? The type of sound you hear, or B, the color of light that you see. So, for example, red versus blue, blue has a very short wavelength, like this, versus red may have a longer wave, like so. So ultrasound is very short, very similar to that wave that you see with the blue one, where ultrasound here will hit particular kinds of tissues, and depending on how dense the tissue is, it will reflect on back to a receiver, and then it will process that and give you an image. Now there's lots of stuff going with Fourier transforms, and you probably have heard of that. Any of you have taken physics have probably heard of the Fourier transform or whatever. We're not going to get into too much detail about that, but just know there's some sort of equation or some sort of methodology out there that gives you that nice image. Okay, so there's one type here known as abdominal ultrasonography here, aka ultrasound examination or sonography, where sound waves are beamed into the abdomen that produces an image of the abdominal organs or viscera, and is good for visualizing fluid-filled structures like, for example, the gallbladder. Another one here is using electrical fields, magnetic fields, for example, magnetic resonance technique, where you use something known as a magnetic resonance imaging, or MRI, where it uses magnetic and radio waves that produces an image of those organs and tissues in all three planes of body, 3D now, not just one, but it doesn't use X-rays. And what's quite amazing with magnetic resonance techniques, or MRI, is that everything in your body is made up of atoms, and there are electrons surrounding these atoms, and I believe we talked about this way back in an earlier chapter. And these electrons have something known as a spin. It can have an up spin or a down spin, and magnetic resonance imaging utilizes these spins in order to produce that image. I'm not going to get into too much detail about that, but we're just going to stop right there. It just uses those spins in order to produce that image. And lastly, we do have here the nuclear medicine test, hepatobiliary immunodiacetic acid scan, or HIDA scan, which is, again, that's another type that uses radioactive imaging procedure that tracks the production and flow of bile from the liver and gallbladder to the intestines. Other kinds of procedures out there, for example, gastric bypass or bariatric surgery, which reduces stomach size. And a lot of times this particular kind of surgery helps individuals control their appetite. And by reducing the stomach size, the stomach gets fuller faster, therefore sending out the signal, a chemical signal, to tell the body to stop eating. Gastrointestinal endoscopy here is a visual examination of the GI or gastrointestinal tract. And you also have here paracentesis, abdominocentesis, which is the surgical puncture to remove fluid from the abdomen. Don't forget that the word suffix here, centesis, means surgical puncture to remove fluid. Now here are some abbreviations that I would definitely want to know. This was pretty quick here. I would also not want to forget laparoscopy here, which is visual examination of the abdomen. Now, some abbreviations I would want to know here, for example, BM stands for bowel movement. Okay, when your bowels or your food feces is moving in through your intestines, known as a bowel movement, or when you are releasing feces, also known as a bowel movement. Also, CT here stands for computed tomography. We also have here GERD, which means gastroesophageal reflux disease. I would definitely want to know that. GI, like GI Joe? No, I'm just kidding here, guys. GI here stands for gastrointestinal. LFTs here stands for liver function tests. IBD stands for inflammatory bowel disease. MRI definitely will come up over and over again, stands for magnetic resonance imaging. Now, NPO, very big here in the medical field. If a physician or medical professional orders that a patient cannot have any foods in order to prepare for surgery or whatever, or a test, they would send out an NPO, which means nothing by mouth. Here are some suffixes that you might want to review. For example, I mentioned synthesis, chesia, ectasia, ectomy, definitely excision, removal, or resection. Again, a lot of these suffixes, a lot of these terms have multiple definitions. It's up to you to go into the textbook, go into the field, and determine which one is the most commonly used and applicable for the term that you are trying to define. Other ones here like megaly, which means enlargement. Graphy means process of recording. Pepsia means digestion. Orexia means appetite. So a person who has no appetite or very little appetite would be known as anorexic, or pertaining to one without appetite. Phasia here means eating or swallowing. Prandial here means meal. Means meal here. We also have raphy, which means suture. Rhea means flow or discharge. Scopy, definitely I would want to know this one, which means visual examination. Stenosis, that's another one. That's a big one here, which means tightening or stricture. And tresia, which means here opening. Spasm definitely means sudden contraction of muscles. Well, that was pretty short. That's the end of the Chapter 6 lecture on Part 2 of the digestive system. I hope that you found this educational. I hope you've learned something from it. Let me know of any comments or suggestions, and I will, until next time, I'll see you all later.